Good morning, my name is Per Anderberg and I'm a consultant orthopaedic surgeon here at Horder Centre. I specialize in knee and shoulder surgery, especially total knee replacement, and also do arthroscopic knee and shoulder surgery. I run my clinics from Crowborough and Seaford, and I do all my surgery here in Crowborough. I am from Sweden and I actually started in med school in Germany, finishing off in Sweden, and was a qualified doctor in 1987 and an orthopaedic surgeon in 1992. Since 2001 I'm working here in the UK full-time. Successful total knee replacement relies on a few things in the preoperative phase, the surgery itself and the rehabilitation. If you have a medical condition, it's really important that you see your GP about it and that you inform us at the Horder Centre as well. We do a thorough check at the pre-assessment, but that's only a few weeks before surgery, so it's important to address any issues before that. It could be to check your blood pressure, skin conditions, blood sugar levels, or maybe your medication needs a review. Try to stop smoking if you can, and don't smoke or use any alcohol in the 48 hours before surgery. And also try to eat and drink healthy in the weeks before surgery. If you have any dental problems, it's important that you see your dentist well in advance. And don't forget how important hearing and seeing is. Maybe there is a need for an eye test or hearing test. Also try to keep as active as possible, and that's important for strength, mobility and balance. Stick to your own routines and active lifestyle, but it can be important to add physiotherapy as well as designated gym programs. Try to avoid too many social contacts in the weeks before surgery. That risks picking up an infection. And if you need a vaccination, it's important to do that well in advance. And avoid coming in for surgery with any fresh wounds on your body. It is also important to avoid traveling if you can in the weeks before surgery, because there is a higher risk of infection doing that, as well as injuries with falls and also a lack of sleep. Try to come in for surgery from your own routines at home. It is important to prepare for your homecoming in good time. That could mean adjustments in your home, in the bedroom, in the kitchen or in the bathroom. You might have to remove mats, avoid going up and down stairs, and also to fill your fridge well in advance. It can also include planning for help from family and friends with your care, peds and shopping. And try to avoid discussing your treatment with others. Every operation is unique in its start to finish. And try to be in the best possible frame of mind coming in for surgery. Try to stay positive, and there are no silly questions here. We are here to help you and assist you throughout the whole procedure.